This is how you prepare for a transfusion. First, you would verify the healthcare provider's orders and then have the patient sign the consent form. You would assess the patient lab values, gather all of your necessary supplies and equipment. You would perform hand hygiene and provide patient privacy by closing the curtain. You would introduce yourself to your patient and their family. Identify your patient using 2 patient identifiers. That would be name, date of birth. If they're nonverbal, it's name and medical ID number. You would explain the procedure to the patient and why a transfusion is necessary. Then you would assess the patency of the IV that is going to be used for the transfusion. You would then obtain the vital signs of your patient. For the pre-administration protocol, you would obtain the blood component from the blood bank and then initiate the blood transfusion within 30 minutes. Check the blood bag for any signs of leakage or contamination. Verbally compare and verify the patient's identity with the blood type and the blood product, and have another person identify as well. Make sure that you check the following: the identification, the patient using 2 identifiers. Make sure the transfusion record number and the patient's identification number match. Make sure that the patient's name was correct on all documents, and then check the unit number on the blood bag against the blood bank form. Make sure the blood type was the same in the transfusion record and on the blood bag. Confirm that the patient's blood type and RH type were compatible with the donor blood. Check the expiration date and the time on the unit of blood. Check the patient's identification information against the information on the label of the blood. Make sure both individuals who check the blood document the verification process. Review the purpose of the transfusion and ask the patient to report any changes that they may feel during the transfusion, and empty the urine drainage collection container if present, or have the patient void. Begin the transfusion and monitor the patient closely. Help the patient into a comfortable position, making sure everything that's in reach, including the call bell light. Raise the appropriate number of side rails and put the bed to the lowest position for patient protection. Dispose of any used supplies. Remove your gloves and perform hand hygiene. And then document and report the patient's response and their expected outcomes.